Hello, everyone. How are we doing? I want to welcome you back to Dr. Gilead Show in 2018. Due to the holiday timing and my travels, I was not able to be on the show in the last 2 weeks. But today, January 11th, 2018, we are back on Dr. Gilead Show. I am your host, Dr. Theo Oswala. I want to say thank you for being on our show throughout the year that ended, 2017. And I'm happy you are joining us again this year, 2018. Thank you very much. We are on WBGR Radio and also on Facebook Live. So today on Dr. Gilead Show, WBGR Radio, and on Facebook Live, you can call on 301 429 9247, 301 429 9247. You can also send us a tweet, or you can also send us a message on our Facebook page, and we will respond. You can ask us a question, or you can also make a comment. Today we are talking about oppositional defiant disorder. Oppositional defiant disorder. As usual, we like to say, please do not use what you hear on this platform to make a diagnosis of yourself or somebody else. Do not what you hear on this platform. Do not use what you hear on this platform to treat yourself. It's always good to get the appropriate diagnosis from a trained professional and to get the appropriate treatment. Dr. Gilead Show, the producers and our hosts, cannot be held responsible for what anyone does based on what they hear. All right, welcome. Oppositional defiant disorder. This disorder involves problems in self-control and emotions and behavior. So it's a behavior. It's a disorder that has effect on the control of emotions and behavior of the individual. We know that even the best behaved child could be difficult to manage sometimes, but sometimes it's excessive. So when a child has some difficulty being managed, that does not mean they have oppositional defiant disorder. But sometimes a child could be a little difficult, and I know parents will agree with me that as a child develops from one stage of childhood to adolescence, there are some changes we all notice, but that does not mean they have oppositional defiant disorder. But children who have oppositional defiant disorder have a persistent pattern of anger and irritability. They have severe irritable mood, and they are always arguing, and they're very defiant and very vindictive. They do not, they get very upset easily, and that causes problems between them and friends and family members and their relatives. Their behavior affects others, and especially towards authority figures in their life. That is oppositional defiant disorder. Sometimes it is difficult to recognize the difference between a strong-willed child, a child that has a very strong will, and a child that has a oppositional defiant disorder. But the truth is that a child that has oppositional defiant disorder will have excessive behavior of the things we're going to talk about. Now, it's not unusual, it's not abnormal sometimes to exhibit some amount of oppositionality or some amount of oppositional behavior at certain stages of a child's development in life. So these things could happen, but it does not mean that that child has oppositional defiant disorder. But it just shows that it's not abnormal. Sometimes people could have some amount of opposition to people, whether friends or family or even teachers. We know that signs of oppositional defiant disorder starts around even before preschool age or preschool years. Sometimes It may develop later in life, but almost always before the teen years, always before the adolescent years of life. So the question that people would always ask me, say, hey doc, what is the cause of oppositional defiant disorder? My child is so difficult to manage. He gets so angry, he gets so vindictive, he is always very angry. What is it that could be the cause? So, and a lot of these things we do not clearly have a good idea of what could be the cause, but we know that oppositional defiant disorder um, could is caused by a combination of effects, biological and environmental. So there is some amount of biological as well as um, environmental factors. Biological factors are things that could be, we know from research that um, some parts of the brain are responsible for some of the things we do. And if the neurotransmitters, which are the chemicals that I always talk about on this show, that control activities and information in our brain, once these neurotransmitters are not at the levels that they should be, people's behavior change a lot. And so that is a biological factor. Um, so and it's also been linked, ODD, oppositional defiant disorder, has been linked to certain malfunctioning of some of these chemicals in the brain. We also know that there are some genetic factors which could be a child's natural disposition or the temperament, the personality of the person. And that is what they inherited from their parents. We are all different. Our genetic makeup is different. The way the nerves in our brains are connected and the way they function is completely different. We know that people inherit some of these from their parents. It could jump a generation, but any subsequent generation could have any of these symptoms that they inherited from their parents. We also know that there are environmental influences in our behavior. It's been known, or it's been shown that parenting, that when there are problems with parenting, and or if there is a lack of supervision in a child, they may end up having some amount of oppositional defiant disorder. Also, it's known that when parents' discipline is inconsistent, if you say you will not buy a toy if you act out and you insist on it, the child will try to straighten up. But if you are inconsistent, you say you will do it and you will not do it, then the child could develop some of these disorders. Also, it's been shown that harsh discipline or abuse or neglect can also predispose a child to have oppositional defiant disorder. So these are the things that that are possibly could predispose someone to oppositional defiant disorder. Now, how often? What is the prevalence? How common is ODD? It is known that somewhat in pre-adolescent years, that is before people turn 11, ODD is somewhat a little more common in males, and the ratio is about 1.4 to 1%. But as they get into the teenage years, that difference disappears. So in teenage years, it's equally common in males and females. But in pre-adolescent years, it seems to be more common in males. But in the general population, is said to occur in 1 to 11% of young people, an average of 3.3% overall. So it's not an uncommon an uncommon disorder, and especially when you have in situations where you have a lot of abuse in families, the absence of the father, the male child, a boy being raised by just the mother, there is no discipline, or even the parents are so busy working, and they do not have time to help the child, discipline the child, help the child know they are right from wrong in that young age. So they end up coming up with this type of behavior. Now, the question is, what are the symptoms? How can I know that my child um, has oppositional defiant disorder? How would I know? How will somebody determine that what the child has is not simple behavior problem? It is oppositional defiant disorder. So, what are the symptoms? These symptoms are drawn from the Bible of psychiatry, which is the Diagnostic and Statistical Manual of Mental Illness, which is what we use to make diagnosis of psychiatric or mental illnesses. And it is said that this should include at least four symptoms from the categories that are listed. There are actually three categories of the symptoms. They are grouped in categories. Number one is that a child with ODD will have angry and irritable mood. Angry and irritable mood, that is one group. Number two, a child with oppositional defiant disorder will also have argumentative and defiant behavior. And also, number three, vindictiveness. Vindictiveness, very vindictive. So these are three groups of symptoms, but I will go through each of the groups. There are classical specific symptoms that that are in these groups. Now, for you to make a diagnosis of oppositional defiant disorder, the behavior, the aggression, the irritability, the vindictiveness should occur at least one individual who is not a sibling. So it must not be, it must go outside the family. So the behavior must be carried out in someone who is not a family member, number one. Also, the behavior or the disorder will have significant effect on work, school, or home activity. It must affect their life in general in one way or the other. And number three, these symptoms must last at least 6 months. So for you to make a diagnosis, the behavior must affect someone outside the person who has the disorder's sibling. It must be outside the family. Number one, it must affect their school or work or their home life. And number three, the symptoms must have lasted 6 months before you can say they have oppositional defiant disorder. And I know a lot of parents who are listening on this podcast will be thinking about their child who has one behavior or the other. I'd like you to just listen clearly and look at the symptoms. That a child has one or two of these symptoms does not mean that they have oppositional defiant disorder. But they must meet the criteria which I just stated. And that is, it must occur at least 6 months continuously. It must affect other people outside the family. And it must affect their life at work, school, or even at home, as the case may be. Now, let's take a look at the first group of symptoms, the angry and irritable mood. So this child has a very angry and irritable mood for no reason. They are just unnecessarily angry. There is nothing you can do that will make them happy. They're happy in 1 minute, the next minute they are boiling like you did something to them. I had a patient recently who is being raised by the mother. Every single thing the mother says makes him angry, and he says, "I hate you, ma. I hate you. I don't want to. I don't want to live with you. I hate you." He goes to school. The teacher is teaching. He is so upset. He doesn't want to listen to the teacher. And I asked him, "Is this just one teacher or all of them?" "Oh, all the teachers. I hate them." that is a child with such an irritable and angry mood. Nothing makes them happy. They just want to be by themselves. And this particular guy, all he does is he goes to school, he comes back, he sits in his room and play games on his phone. When food is ready, the mother calls him, he says, I'm coming, and he stays in his room, goes to get his food, goes back to his room, and that's all he does. And unfortunately, there are no other kids in the house. He lives just with the mother. So it is so difficult for the mother to manage him. So very stressful. So this child is very angry and irritable. So in this group, one of the symptoms is they often lose their temper. And you are wondering what just happened. For no reason, he has an outburst. He goes from 0 to 1,000 in 1 second. They lose their temper for no clear reason. That is classical. That is classical. The reaction is not in any way proportionate to whatever the individual said or whatever the mother or the father said. Sometimes, without even saying anything, they get very upset. They lose their temper, and they could do all manner of stuff. The kids with oppositional defiant disorder are often very touchy. They are easily annoyed by other people. For no reason, even looking at them, they get angry. And they ask you, why are you looking at me? You got a problem? You got a problem? And they are charging at somebody. They're charging at strangers in school, even friends, classmates. For no reason, they get very upset with them. Oppositional defiant disorder, they are angry and very irritable. Every minute they're getting into fights. Someone looks at them, they ask, you got a problem? Why you look at me? They for no reason. That is number 2 in that group. Also, they are very angry and very resentful of other people. They don't see anything good in somebody else. If you put on a nice clothes, it irritates them. If you come out, you're smiling, it makes them angry, and why are you laughing? What's the problem? Why are you so happy? So they are upset by every single thing around them. That is the first group. They are angry and irritable. They have angry and irritable mood. The second group of symptoms is they are very argumentative and they have very defiant behavior. Very argumentative. They argue a lot. They argue for no reason. So the first symptom there, these kids or these young people argue with adults and people in authority position. They are very angry. They are upset. They argue with teachers, and it's not that they know what they're talking about. They're just argumentative. When somebody says A, they will say B, just because they want to be on the opposite side. They want to be on the negative side. They argue a lot. How can you argue with your teacher who is teaching you in class? It is completely out of place. And you ask them, why are you arguing? They cannot even tell you. But they like to cause strife and argument, and they do that with authority figures. They do that with adults. They want to prove to people that they are better. They don't want to be under anybody. They don't want to take instructions from anybody. So they argue and argue and argue. So they're very argumentative. That's one. Now, they often defies and refuses to comply with rules set by adults. So if the teacher says, everyone sit down and listen to what we're talking about today, they want to do exactly the opposite. The teacher says, in the next 30 minutes, I want everybody to sit down, don't go out. That's when they're going to get up, say, I need to go pee. The teacher says, sit down. They say, no, I need to go pee. Because they know that someone who wants to go use the bathroom, you can't hold them down. So they are always ready to defy every rule. They refuse to comply with adults. When adults say do something, they don't want to do it. This kid I was telling you about, Every time the mother says, okay, it's time to get up and get ready for school, he says, no, I want to sleep a little more. If the mother says, okay, today I'm going to drop you off in school so you can sleep a little more, he says, no, I'm going to take the bus today. So everything that is said, he wants to do the opposite. That is how people with oppositional defiant disorder um, carry out their life activities, especially in opposition to authority figures, adults. They want to do what they want to do. Number three, in this group, they often deliberately annoy people. They intentionally annoy people, intentionally make people angry for no reason. The question is, why do you want to make people angry? Why do you want to make people angry and upset? But they don't know. They just do that. That's their life. That is the way they are made. They always um, make people angry. They always annoy other people. And two, they often blame others. They often blame others for their mistakes and bad behavior. Always they will not take responsibility for what they did. They want to always blame other people. When you say, hey, you did this, they say, no, I did not do it. It was because you made me do it. That is a child with oppositional defiant disorder. They make mistakes in their lives. They fail in school. They don't do well, and they want to blame their parents. Oh, because my mother did this, or because my father did that. That's why I'm doing this. And most times when they come to me, I try to encourage them to um, take responsibility for their actions, look at the effect of what they're doing on themselves. You don't go to school, or you go to school, you're fighting with the teacher. It is completely at your disadvantage. You are the one that is losing. The teacher is not going to school anymore. It's you that need to study. But they think they are hurting the teacher, or they just fail. They think they're hurting the parents. So they deliberately want to annoy people in authority, annoy their parents who tell them, listen, you need to pass, you need to do well in school. When you say that, they completely do the opposite. They stay away from school. Even if they go to school, they just walk the hallways. They don't even listen to the teachers. And they end up failing, and they come home, they think they've done they've done something annoying to their parents, without knowing or forgetting that they are the people losing. Number three, in another group, vindictiveness. They're very, very vindictive. These young people are very spiteful and very vindictive. They do not forgive. When you do anything to them, they will come down on you. They do things that will hurt you. They do things that will make you upset. They make sure they get back to you. They get back at you. They make sure that they make you upset all the time. They have a hard time forgiving people. And if they don't get you, they will continue to wait for an appropriate time to harm the person. And that is why sometimes it goes to oppositional defiant disorder can people with oppositional defiant disorder can graduate into having conduct disorder, which if the symptoms start before teenage years. So because of the behavior, the vindictiveness, they begin to violate the rights of other people. Then we diagnose them as having conduct disorder. So these people, they also have, they don't care. They don't care about how anybody feels when they are doing these behaviors. Now, for you to say that a child has oppositional defiant disorder, these behaviors must be displayed more often than is typical in an average child. it must happen more often than in the friends of the child. So it's not something that, oh, a child just does one thing or makes a person annoyed one time or refuses to obey the teacher, they are diagnosed as having oppositional defiant disorder. No, it must be very common. Must happen more than is typical for that child. If a child is less than 5 years, the behavior must occur on most days for a period of at least 6 months. So if the child is younger than 5 years, it must happen every single day for at least 6 months. I'm sorry. So, but if the individual is above 5 years, if it occurs at least once a week for at least 6 months, they could also be diagnosed with oppositional defiant disorder. So this is, like I said, it's a disorder that is not very, it's not uncommon, because if it happens in 3.3% of the total population, it is a lot. 3.3% is not a small number, and that's why in schools, for those of us who see school children, we get the reports every single day. This child is so difficult to control, it's so difficult to manage, he's disruptive in class, he's distracting other kids, and he's fighting, he will not obey the teacher. A lot of the times, the police can be called. So, question, how severe can oppositional defiant disorder get? Sometimes it might vary in severity. So you have mild symptoms, where it's said to be mild when the symptoms occur in settings such as only at home, school, work, or with peers. So it happens only in one setting and is very mild. So if it happens only in one setting, maybe at home or in school or with peers, it is defined as mild oppositional defiant disorder. Now, if it happens in two settings, which could be it happens at home or in church, or it happens at home and in school, is defined as moderate. Now, but also it could be very severe. When it occurs in more than 3 settings, if the symptoms occur in 3 settings or more, it is said to be severe oppositional defiant disorder. So it is not something that we just make the diagnosis because a child is acting inappropriate or unlike other kids. Now, it's worthy to know that in some children, the symptoms may first be seen at home, but with time, it extends to other settings, such as school or with his friends. So parents sometimes will always notice that, my particular child is just unnecessarily angry. He is very argumentative, he's very angry, he is very irritable for no clear reason. They notice it at home. Then gradually, they begin to hear that, whoa, he did this in school, he acted this way in public, and before you know it, the child begins to it begins to affect the child's activities in other settings, whether it's school or in sports and learning center, or when he goes out with a group or his classmates or his friends. He begins to act in such a way that he is very angry and irritable, very argumentative and disobedient to teachers. So it could start at home and gradually begin to affect the child's life in other settings. At this point, we would like to take a little break, and we want to recognize a few people who have joined. Mr. Benga, Mr. Okay, thank you for tuning in today. But I also want to say thank you to Paddock Healthcare Pharmacy, who is one of our sponsors. Don't go away. We're talking about positional defiant disorder today. We'll be back shortly. Thank you.
Godwin Motors has got you covered. Check out their credit stimulus package sales event. 100% credit approval regardless of credit, and emergency lenders on hand. Godwin Motors is located at 9071 Lanham 7 Road in Lanham, Maryland, 20706. Log on to their website at www.godwinmotorsonline.com or call 301-577-0400. That's 301-577-0400. That's Godwin Motors, and let them know you heard about them on WBGRsports.com. Are you looking for a warm and caring dental family that can cater to all of your needs? The Michael Family Dental Team is knowledgeable and sensitive to your dental needs. We offer the latest X-ray technology for better diagnosis and care. We can offer 6-month smile, a quicker alternative to traditional braces, Invisalign, implants, cosmetic dentistry, root canals, and extractions of all kinds, and great care for your children. We are currently offering a $99 new patient special, which includes cleaning, x-rays, an exam, and bleaching trays for the remainder of the 2014 year. Look us up at michaelfamilydental.com and call us at 301-265-1650. That number again, 301-265-1650 to schedule an appointment today.
All right. Thank you very much, guys. Welcome back to Dr. Gilead Show. Today we're talking about oppositional defiant disorder, which is one of those disorders that affect our young people. We've said that it's not an uncommon disorder. It happens in about 3.3% of our population, and it happens in young people. It could start before the age of 5, and also in teen years. We've talked about the symptoms, the aggressiveness, the anger and irritability, and the vindictiveness. These things we've talked about. For those who are tuning in, you can listen to this again on our Facebook page. You can also check it out on YouTube. You just Google Dr. Gilead Show, and you will see the full version of this. We are on Facebook Live, Dr. Theo Oswala, MD. You can also listen to this podcast on WBGR Radio. You can also call and speak to us, ask questions, or make your contribution on 301-429-9247, 301-429-9247, and make your contributions or ask your question, and we can take those questions. Thank you, joining Victor, Benga, and okay, thank you for joining today. Today, as we talk on oppositional defiant disorder, we want to look at the risk factors. What is it that could make somebody or a child have oppositional defiant disorder? The risk factors of oppositional defiant disorder could be, is difficult to say, but this disorder is a very complex problem. The possible risk factors include our temperament. A child who has a temperament that includes difficulty regulating emotions, such as highly being emotionally reactive, that is very little thing gets them upset, they cry, and they could go into big tantrums. Or they have difficulty tolerating frustration. These are the things that could make a child be predisposed to having oppositional defiant disorder. They have a bad temperament. They just cannot control their emotions. The other factor could be parenting issues. If a child is abused or neglected, a child that everything the child does is wrong. Everything the child does, he does not get any compliments. Everything the child does, he gets beat up for nothing, or he's neglected, or parents are just too harsh or inconsistent in the way they discipline the child, can predispose that child to having oppositional defiant disorder. Sometimes also lack of parental supervision. You have children, you must make out time to supervise them. You must make out time to help them. You must make out time to spend time with them. We know everyone, all parents are busy doing different things, but at one point or the other, one parent should make out time and spend time with the kids. Give them some supervision. If you let them just do what they like, they may end up having oppositional defiant disorder. Now there are other family issues. If a child lives with a parent or in a family where there is so much family or parental discord, where there is fighting all the time, argument all the time, that child could have oppositional defiant disorder. Or a child that the parents or one of the parents has mental illness, or the parents that are abusing substances, because that's a parent who is using drugs cannot appropriately, adequately, consistently supervise their child. That child could develop oppositional defiant disorder in course of his or her development. Now, let's look at what are the complications that could happen if a child has oppositional defiant disorder. Now, if a child has oppositional defiant disorder, they have a lot of troubles at home with their parents, and also a lot of problems with their siblings. They also have a lot of problems with their colleagues in school, and a lot of problems with teachers. If they are old enough to go to work, they will have problems at work with their colleagues, with their supervisors, or authority figures at their place of work. And what happens is people will keep away from them. So they struggle to make friends. And when they have difficulty making friends, they do not develop relationships, they remain perpetually angry and irritable. That is when you hear of somebody who develops conduct disorder, antisocial behavior, who goes to a workplace and shoots down everybody. So we must be very careful how we manage our young ones, our siblings, our children who have a bad temperament, who have difficulty tolerating or relating with authority figures. I remember one of the shooting things that happened. The guy was queried at his job, and he was fired, and he went and got a gun and shot people. These are the kind of things that happen when a person has oppositional defiant disorder. The other problems, the other complications that could happen if a person has oppositional defiant disorder is it leads to problems such as poor performance at work or in school. You can imagine a child who every single thing the teacher says, he says no. He is always opposing the teacher. He is always saying no to the teacher. Yeah, can you go to school? And you don't want to listen to your teacher. You are there to learn. So you have to take what your teacher says. When your teacher says sit down, you need to sit down. When your teacher says 5 plus 10 is 15, you cannot say it is not, because you are the student. But people with oppositional defiant disorder, they are so disgruntled and angry and irritable, they do not agree with what anybody says. They're so disrespectful. So what happens if they are in school, their school performance will be very low. If they are at work, they cannot achieve. And what happens? They end up getting fired from the work. The other complication is antisocial behavior. What happens? Because they are very vindictive, they they do not care about the emotions, about the feelings of other people. They trample on they trample on the rights of other people. They, they, they don't care how other people feel, and they could hurt people without minding, physically or verbally. So they're very, very antisocial. And at the end of the day, they may hurt somebody badly, or they may even kill somebody. The other complication is poor impulse control. They have a hard time controlling what they do. They have a hard time managing their impulses. For a regular person, or normal person, if there is anything like that, or for people who do not have oppositional defiant disorder, if someone upsets them, the tendency is to talk about it. Say, hey man, why are you doing that to me? How come you're saying that? But people who have oppositional defiant disorder have a lot of difficulty managing their impulses. They get very angry and they get into fights. They can go from 0 to 1,000 in 1 minute. So they have a very hard time managing their impulses. Also, another complication is substance use. They end up doing a lot of drugs to help control their behavior or their impulses, or they use drugs to stimulate themselves to be able to do what they would like to do, to talk back at people, to be bold enough to say things to people. That is one of the complications of oppositional defiant disorder. Also, people with ODD can commit suicide. It's not uncommon because they cannot handle frustration. Their frustration tolerance is very low. They don't know how to manage impulses, so they take the quickest road out, and that is by killing themselves, by committing suicide. And the danger is sometimes they kill people before they kill themselves because they end up having antisocial behaviors. They have no value for the life of somebody else as well as their own life. And if they are high on substances, that makes it worse. They can kill. They can kill without even thinking, and they can hurt themselves without thinking. Now, young people with oppositional defiant disorder may have other mental health care issues. And commonest among them is attention deficit hyperactivity disorder, ADHD. Excuse me. On this platform, we have talked about attention deficit disorder and attention deficit hyperactivity disorder combined type. We talked about this. So children with oppositional defiant disorder are also predisposed to having other symptoms like ADHD. Also, they have, because of their anger and irritability, poor frustration tolerance, they may end up having depression. They become depressed. They isolate. They cannot relate with people. Because of their behavior, everyone isolates from them. Everyone stays away from them because you cannot predict what they will do. So they become depressed. Also, they could have anxiety disorder. Because they cannot predict how they behave in the public, they feel nervous when they are going out. So they have anxiety as well. They could also have conduct disorder. Conduct disorder is another form of behavioral issues. They have similar symptoms as antisocial personality disorder. They trample on the rights of others. They can hit people. They can hurt people without caring. They don't mind how people feel with what they say or what they do to them. Other problems, other complications is they could have learning disorders. They could have learning and communicating or communication disorders. Because of their behavior in class or because of their the way their brain is wired, they have difficulty learning. They have difficulty doing schoolwork or even doing learning on the job. It's been known that treating these uh, other illnesses like depression, attention deficit disorder, anxiety, conduct disorder will help relieve the ODD symptoms. So sometimes when people come to me, they have hyperactivity, attention deficit disorder, but they are very oppositional. So one of the things I do is I try to treat for the hyperactivity and as well as their poor impulse control. And I have noticed that once those other symptoms are treated, whether it be attention problems or anxiety or depression, the people's symptoms of oppositional disorder will begin to wane, will begin to get better. And it's also it's worth knowing that it may be difficult to treat oppositional defiant disorder if these other symptoms are there. If someone has anxiety or has depression or has attention deficit disorder and you do not take care of those, it will be hard for the individual to be able to manage his or her emotions. So it's always good to appropriately evaluate and treat these other symptoms or these other disorders that occur with along with oppositional defiant disorder. So what are the treatment modalities? How do we treat oppositional defiant disorder? A person, a child who has difficulty focusing, difficulty obeying adults, he gets upset and angry, always irritable, will not obey the teacher, obey the parents. How do you treat such a child? The treatment, the best treatment for oppositional defiant disorder is psychotherapy. That is talk therapy. And there are people who are specially trained for those therapeutic treatments. Now, what psychotherapy does is it helps the child develop more effective coping mechanisms. The way it helps them learn how to cope with their issues. It also helps them learn problem-solving skills. Now, they get into conflict with people. Therapy helps them to learn how to manage themselves when people make them upset or when people make them angry. It also helps teach them how to express their anger. You can be angry and do no harm. You can be angry and calmly, quietly say the individual causing you the anger to back off instead of getting into fights. Also, therapy helps the individuals to how to express things better instead of expressing their anger or expressing their feelings in a very angry and dangerous way. They learn how to express it in a more less dangerous way. The main treatment, the mainstay of treatment, the main type of therapy is cognitive behavioral therapy. Now, what cognitive behavioral therapy does, it helps reshape the child's thinking. So what happens is, a lot of the times, the child does not understand why he's acting the way he acts because he does not know himself. He does not understand himself, why he is behaving the way he behaves. So cognitive behavioral therapy directs the individual inwards to look at themselves. Why do you act how you act? Once you learn it, you learn why you act the way you act, then you learn to improve on how to act. Someone does something wrong to you, or someone looks at you, there's nothing wrong in looking at somebody. You learn to believe that people could look at you and not really mean any harm. So when people look at you and you say, hey, you got a problem, why you look at me? Once people get in treatment, in psychotherapy, they learn other things, why people could be looking at you. It does not mean that they have a problem with you. It does not mean that they want to do something to you or whatever the individual may be thinking. No, you learn to look inwards at yourself and improve on your behavior. Another type of therapy is family therapy. This may be used to improve family interaction. It is used to improve the way families relate to one another. It is used to help the parents, the siblings understand the individual. Even the individual also looks inwards into himself and understands how to improve his relationship with his family members. So family therapy improves communication. It also improves family interaction among family members. If communication breaks down, there is always a problem. That is why family members must learn to talk with one another in a cordial way. So for a person who has oppositional defiant disorder, once he understands that it's not what you say, but how you say it, then he has more peace with himself and he doesn't make other people angry. Now, there is also a specialized therapy technique called the parent management training. The parent management training. This parent management training teaches parents on how to positively alter the child's behavior. Parent management training. Parent management training helps teach the parents on how to positively affect the child. It teaches the parent on how to encourage the child, even though they are struggling with their behavior, but it is not putting them down. It helps the parents even at the peak of anger, even at the peak of the child's irresponsible behavior and oppositional behavior. The parents still shows some love, shows some good direction, shows the child how to do things better. And at some point they're going to say, well, if I've been behaving so badly and my mother is still nice to me, nicely talking to me and not yelling, a lot of people will calm down and begin to listen and begin to question their behavior as well. Now, behavior management plans often involves developing contracts. So sometimes parents can develop contracts between themselves and the child. In this way, it identifies towards positive behaviors. And so, for example, if a child writes a contract, say, I'm going to go to school, and when I go to school, I'm not going to be oppositional to the teacher. Every single thing the teacher says, I will do. And the parents will say, okay, if you go to school throughout this week and you have all greens, and that means you were not oppositional, you were not acting out in school, by Saturday I will buy you a Nintendo or a game console. Once the child sticks to it, sticks it out, you have to positively reinforce that behavior. You have to positively encourage the child. So you must follow through when you make a promise. So that is positive reinforcement. Also, there may be consequences for behavior. So if a child does something and parent sees it, you have to take away one of the things they love most. And that is a kind of consequence, or a consequence for their action, which could be termed punishment for negative behaviors. With this, the child knows that the parent is not playing. When the parent says, I will do something, I will definitely do it. So parents must follow through if they set out a goal to punish or to withdraw any item the child has. That is psychotherapy, cognitive behavioral therapy, family therapy, as well as parent management training. Behavior management plans could also help. Medications. There are no clearly approved medications for oppositional defiant disorder, but ODD coexists with other illnesses. ODD sometimes also occurs in people with depression, anxiety, attention deficit hyperactivity disorder, as we have said in the past. So what happens is, if any of these disorders are treated, for example, a person who has depression isolates in his house, irritable and angry, at the end of the day, you treat the depression, you treat the anger, you treat the irritability. What happens is their behavior, their oppositional behavior will get better. They'll begin to wane, and they can have a better relationship with people. In that aspect, medications help a lot. And when the symptoms are treated, they have improved relationship with family members. They have a better relationship in school. Treatments, whether psychotherapy or medications, can help restore the child's self-esteem and rebuild a positive relationship. You can imagine a child who is always opposing the teacher in class. That particular child who is the one that always disrupts the class. And I have had young people come to me and they say, nobody likes me in my class. And I ask, why? How come they don't like you? Because they don't want to play with me. How come they don't want to play with you? Because I'm always getting in trouble. By the time I play with them, I get into fights with them. So everyone runs away, everyone shies away from them. But once they are treated, and actually when everybody stays away from them, it affects their self-esteem. They feel like they are nothing. They feel like a piece of trash. They feel like they are not human. But once their behavior is appropriately treated, or whatever comorbid issues they have is treated, then they come to class, they are calmer, they relate with people better, they are not upset unnecessarily, people begin to reconnect with them. And what happens, that improves their self-esteem, they feel good about themselves. And that brings a better relationship between them and the parents, a better relationship with other adults, and a better relationship with their teachers or even care providers. Once that happens, there is joy in their heart. They begin to act responsibly. They stop being oppositional. But at some point, who they are could come up, but they learn to manage their behavior so that they can have friends, have good relationship with other people. Most people set out trying to be good, but a lot of times, because of the way their brain is wired, they are very angry and irritable, and they're very vindictive towards others. So parents today, listening on this podcast, or those who will be listening to it on YouTube or on our Facebook page, you don't have to go it alone in trying to manage your child with oppositional defiant disorder. There is great help out there. There is help out there. People can give you help. There are professionals who are trained to give you help. There are doctors who are trained specifically for managing oppositional defiant disorder and other behavioral problems. There are also therapists who are psychologists, and also we have some child developmental experts who know how to manage people with this illness. So do not be bashy, Once you feel like your child or your spouse or your loved one meets the criteria based on what you've heard on this platform, please go get help for them, and their life can change, and you feel better, and you have a better relationship with them. So it is doable. There's help out there. I want to say thank you for tuning in today, this platform. I want to thank Benga Oyiloye. I want to thank Victor. Also, Godfrey. Godfrey is tuning in from Mozambique, somewhere in South African area, and others from all across the globe. Those I can see, those I cannot see. Thank you for tuning in. Today we talked about oppositional defiant disorder. If you have any questions, you can ask on our platform, on our Facebook page. I am your host today at WBGI Radio, and also you can call me at my office, 301-577-9111, 301-577-9111, or you can hit me up on my Facebook page, Dr. Theo Oswala, MD. Thank you for tuning in. We'll see you again, same time next week, Thursday at 1 p.m.